Good day, everyone, and welcome to our webinar series. This is Jawahar Al-Hamid, Quality Patient Safety, Creativity, and Corporate Excellence Director at King Fahd Hospital, Hufuf. We are here today to talk about promoting patient safety with the Good Catch project with our honorable speaker, Mr. Fahad Al-Fredi, Head of Risk Management Unit at the General Directorate of Equality and Patient Safety at Ministry of Health in Saudi Arabia. And he will tell us how the good catch and safety culture have a direct impact on improving services to health facilities toward a safer healthcare for patients. Mr. Fahad, the floor is yours. Please feel free to type your questions in the question and answers icon, and be informed that all questions will be answered at the last 15 minutes of this webinar. Welcome again, and Mr. Fahad, the floor is yours.
بسم الله الرحمن الرحيم والصلاة والسلام على نبينا محمد وعلى آله وصحبه أجمعين. Good afternoon, good evening, everybody. Welcome to today's webinar talking about promoting patient safety with the Good Catch project. I'm just gonna stop the video here, so let you concentrate on the presentation. I'm Fahad Al-Fredi, Head of Risk Management Unit at the General Directorate of Quality Patient Safety. We will have a journey today talking about our implementation of the Good Catch project in the Ministry of Health. A busy day at the OPD, the physician is opening the electronic medical record according to the clinic's patients list. A patient missed his appointment, and the second patient in line entered the clinic. The physician failed to identify the patient correctly. He completed his notes and the medication prescription, and the patient proceeded to the pharmacy. The pharmacist caught the mistake at dispensing. Two patients from the same department transferred at the same time to the operating room, and blood samples were sent for cross-matching for both patients in the same time to the lab. The lab tech had a crowded workstation, and their cross-matching results were exchanged with one another. Upon receiving the patients in the operating room holding bay, the discrepancy was caught by the receiving nurse. In the neonatal ICU unit, a nurse was on duty at 4 a.m. where she noticed electrical sparks. She immediately removed the newborn from the danger area and activated code red according to the policy and procedure. These are documented good catches incidents that happened in our facilities, documented through the Good Catch project promoting proactive identification of incidents. So what's a good catch? It's referring to an event or a set of circumstances that has the potential to cause an incident or a critical incident, but did not cause harm as a result, either of a chance, a timely intervention, or mitigation. Or it can be described as an error caught before reaching the patient. Why? Why is it important to be reporting near misses and good catches? This is the Herrich law. States what? That for every 3,000 at-risk behavior or acts, there are 300 near misses. 29 of those are minor injuries and one major injury or death. Imagine how many at-risk behaviors, how many at-risk acts happening each and every day in our health facilities, in our hospitals, and on the front line or side. Good catches or near misses. We have a lot in our facilities. Events where safety barriers are crossed, that happens a lot. Events where injury could have occurred, but did not, thank God. Or minor incidents or injuries with a potential to be more serious. And unsafe conditions or unsafe behaviors. While I'm reading this, everybody of you are thinking about previous incidents that happened in the past, that happened in your facilities, where these points are applied, that events where injury could have occurred, but did not. Issue with near misses, they are not reported in healthcare facilities. Why? There are a lot of reasons, but maybe the main reasons are time restraints. Everybody is busy. I don't have a time to report an incident or a near miss. If nothing happened, why I would report it? These are always the things that we heard about when talking about near misses and good catches. Instead, we need near misses to be reported to know what happened and why did it happen. And most importantly, what can be done to prevent it from happening again. Safer environment, a safer facility. Still with the why. The University of Texas, they had a lovely initiative called the Close Call Reporting System Initiative. This initiative showed what? That good catches occur as much as 7 to 100 times more frequently than serious events, but often go unreported. Serious events, we have in the Ministry of Health in Saudi Arabia, we have a list of sentinel events that are mandatory to be reported immediately within specific categories of events. So imagine that good catches happen 7 to 100 times to serious events. We have a question for you, our audience, with Mrs. Jawahar.
Thank you so much, Mr. Fahad. So let us go please to the question. Is it clear for you? Are you able to see the question? Try to answer, please, by using the whole question. The question is, what is the definition of a good catch? A safety event that caused harm. B, an error caused poor reaching the patient. Or C, a sentinel event. Don't answer in the chat, try to answer on the screen appear to you. So now, waiting for the result. Yeah, so
yes,
15% answered A, and 77% answer P, and 8% answer C, which is sentinel event. And Mr. Fahad, that's been the near miss or the good catch is defined clear for them. So that's why all of them answer the correct answer. That yeah, the near miss is event near to happen or happened, but not reach the patient, or the harm not reach to the patient. Thank you so much, and let us continue our presentation with our speaker, Mr. Fahd.
Thank you very much. Moving on, we are still at the why. Why we thought in the Ministry of Health that we needed the Good Catch project. We are transparent that we are under-reporting in the Ministry of Health of Saudi Arabia. On the right side, on the top, we did a risk management program survey in 2017 that was conducted in 179 hospitals. 40% of these hospitals had zero no harm event reported, meaning they did not report, 40% of these hospitals did not report any near misses, which is a very big number. On the bottom right corner, this is a screenshot of MOH, Ministry of Health, Saudi Arabia, OVR report for the year 2018. Our OVR rate then was 0.7 OVR per bed per month. We genuinely acknowledge that we are under-reporting. We want to enhance the reporting culture. We want to enhance the reporting of OVRs, occurrence, variance report, or incident reporting. So 40% of 179 hospitals did not report near misses. What are we missing here? We are missing the opportunity to learn from near misses, from good catches, learning from these events, preventing harm, being proactive when identifying risk, and missing on the opportunity for a safer environment, a safer facility for the patient and for the healthcare workers. The project, let's take you through how did it started and the phases of the project. We wanted a different look. We wanted a different angle when looking at reporting and incident reporting. We are using the same reporting culture, the same reporting mechanism, either paper-based or electronic, the same stuff, but looking at incident reporting from a different angle, a different look, a fresh look. We want the changing of the terminology. We want people, because they are using phrases that emphasize the negative, such as near misses and close calls. We want a change of terminology. We want to emphasize the positive side, focusing on the positive, the term good catches, great catches. We want in the culture within healthcare workers. Want to involve, engage our staff, our people. When you engage people in such projects, they are your eyes. People will be proactive to be reporting risks or hazardous situations or any circumstances that can be harmful to the patient, to the facility, or to the staff themselves. Imagine that. People will be more eager, they are already, but they will be more eager to be reporting incidents and good catches in your facility. There are a lot of objectives for this project, but mainly we wanted to enhance the proactive identifications of risks and incidents in Ministry of Health facilities. We want increasing the number of near misses reports Referring back to our survey, 40% of 179 hospitals had 0 near misses reported in 2017, and encourage facilities to recognize health workers who report good catches, empower them, and eliminate the fear of punishment for patient safety events reporters. The project. The kickoff workshop was held in Riyadh on October 15th, 2018. We had all the directors of quality patient safety meeting in Riyadh, discussing the kickoff of the project, examining previous projects which were implemented in 2 hospitals in Saudi Arabia. In that meeting, they volunteered 33 facilities, including general hospital, maternity hospital, psychiatric hospitals, and primary healthcare centers to participate in the first phase of the project. We set 2 goals. By the end of 2019, we'll start in January, and by the end of 2019, we'll have 100 facilities implementing the good catch, and we will have 1,000 good catches. These were the project goals. So, how did it go? By January 2019, at the start of the project, we had 33 facilities implementing the Good Catch project. By June, we had 56 facilities. And by January 2020, at the end of the project, we had 107 facilities in Saudi Arabia, MOH hospitals implementing the Good Catch project, from tertiary hospitals, general hospitals, maternity, children, psychiatric, and even primary healthcare facilities. It's been a long journey. It was an interesting journey with these facilities. We wanted a friendly competition. We wanted staff to compete with each other. We wanted leadership recognition of Good Catch reporters. We encouraged units to compete with each other, teams. This happened in our hospitals. We wanted to empower our employees to report, empower our health workers to speak up. We want them to speak up for patient safety. The 4 E's of a reporting culture: establish trust, encourage reporting, eliminate the fear of punishment, and examine errors, close calls, and hazardous conditions. This is according to the Joint Commission in 2018. These, the 4 E's, we are looking for that, we are pushing for that, and the Good Catch project helped us to build that in our culture. We wanted to utilize our safety huddles, which are a very successful project, another successful project in the Ministry of Health, where people discussed safety huddles, safety issues in their units, in their department, and discussed good catches and how can they prevent it from happening again. We looked at the resources. Implementing a project like this, you are using your same staff number, no increase in staff. You are using your same staff, your quality and risk manager in your hospital. The reporting system, you can use it either electronic or paper-based. Incentives for the Good Catch, rewards. We know that our hospitals, our facilities, when implementing a project like this, have different resources. We left it as an open option for them. This is an open option for any facility to try out any kind of incentives that were really varied from just a thank you, a verbal thank you, till a gift of gold for a good catcher. This has happened in our facilities. So it's a big range. You cannot limit yourself with the incentives. Going now to question number 2.
So question number 2. The question is, it is based on your culture in your facility. Is this a statement true or false? Near misses are always reported in my health facility. So just check true or false.
I hope it's true.
Let's see now the result. So as you see here, 42% of our attendees answered that this is true.
Okay.
And yeah, the highest percent false. So our message, please just try to encourage your employees to report, as this considerably one signs for the health or healthy facility that really maintain the safety, and everyone really responsible to report any event which is really growing or threat the safety of the facility. Mr. Fahad, if you have any comments also?
Yes, 60% said it's false. Near misses are not reported in your hospital. This is the question that started this project, our thinking of the project in our Ministry of Health, Saudi Arabia. You have to be transparent and tell it as it is and work on it. And one of the initiatives is this project to increase the reporting, especially near misses. So moving on, with our facilities, we went on, did workshops on site with our people, with the facilities people, with the quality patient safety and the staff, the champions. And we enabled people to do it through a framework. We created the Good Catch framework to enable facilities to implement the Good Catch project. What does it contain? It contains the definitions, the objectives, the Good Catch criteria that will help facilities to determine the good catches, the key elements of the Good Catch project, and the form that they should use when reporting good catches and including reference. It was a very good tool to use. So getting started, these are points that we encountered during our project that will help you to implement this in your facility. Choose a theme or a slogan to promote the project. Fishing, for example. Always use positive language when collecting good catches instead of collecting near misses. Get support from top leadership. This is very important. Present the program to the board and executive leadership prior to launch. Get their commitment from the start. Involve leadership in the kickoff, and please provide the regular feedback on program actions. Choose a person or a team to exclude or include good catches. These are important tips to implement such a project in your facility. Present and describe the program to all staff in departmental meetings and through all communications, either posters or you have your internal email system. This is very helpful to maintain the culture and the idea of reporting good catches. So, are all incidents or are good catches? We cannot cover everything, but to help our facilities implement the good catch, we did we created some exclusion criteria for the good catches. I put this picture. This is a thank you for all our COVID heroes all over the world. From every country, every nationality, you were our heroes going through this pandemic. Thank you very much. So our exclusion criteria were like this. Anonymous reports are not considered as good catches. Why? Our primary objective was recognize employees, encourage them to report. Anonymous report doesn't provide this. Reporting all past event, retrospective. We wanted a proactive approach to reporting incidents. Reporting long-standing, unresolved issues in the facility. It's not considered as a good catch. We wanted proactive identifications of risk and incidents. Unclear description or data of the incident. We wanted our staff to adhere to the OVR or incident report form that covers the taxonomy of the event according to the patient safety taxonomy of this event that will help us when analyzing the data. Reports with no documented action done by the reporter. The documented actions, patient is first, staff safety is first. This is our main concern. Documenting the good catch or reporting the good catch is the second thing. Our priority is our patient safety. Inability to verify the authenticity of the event or the lack of proof. Why? Because this will compromise the trust of healthcare workers with the program, with the reward. They will be not trusting the results and the rewards being given to the good catchers. Reports that are inherited within the purpose of an activity, like environmental safety rounds, because this is the scope of the activity. You are supposed to go on a safety round and report incidents or hazardous situations. We wanted health professionals who go more and beyond their comfort zone, doing more than what's asked from them to report good catches. These were the exclusion criteria when reporting good catches. Implemented, we have a criteria for exclusion of good catches. We want the momentum going for the project. These are good points. You need to provide the regular updates for the leadership, for your staff within your communication channels. You can expect a decline in the good catches reporting because the use of action plans and other interventions from the reported good catches, you will see a decline in the good catches, which is normal. Just push on and keep the momentum going and continually emphasize the importance of reporting. Always and always engage leaders in regular conversations with the staff during the safety rounds, during the administrative rounds. Let them have a conversation with the staff, the frontliners, talking about good catches and safety events and the reporting culture. What did we find? Good catch will demonstrate the leadership commitment to patient safety, which is very important. It will reduce the tolerance for risk in our healthcare facilities. It will avoid the complacency and trusting that or thinking that we are not vulnerable for error or not vulnerable for sentinel events or risky situations. It's a very good tool to identify workplace hazards, employee involvement in patient safety programs again and again, and it will allow you as a quality manager, patient safety officer, or a risk manager for the identification of possible trends in your facility. Now for question number 3. Ms. Jawahar, Ms. Jawahar.
Yeah. So question number 3. One of 4 E's of a reporting culture is A, enforce the punishment of a staff who commit mistakes. B, engage administrative management in investigating patient safety events. C, examine errors, close calls, and hazardous conditions. So we have maybe in PNC, the percentages are similar, but I'll just explain based on the presentation by Mr. Fahad that C is the correct answer. Examine errors, close calls, and hazardous conditions. As you saw in the previous slides, that this is one of the 4 E's. So Mr. Fahad, do you have any comment?
Yes. This is one of the important aspects of patient safety reporting culture. We want to eliminate the fear and eliminate the fear of punishment by administration. We want our healthcare workers to feel safe, to report, to be empowered, to report any safety events and being transparent. So let's have a look at the project numbers through the journey through 2019 and come along. As we said, we had the start on October 2018. By January, we started the on-site workshops. We explained the framework and how to collect, document good catches. By February, we had our first good catch report in the Ministry of Health on the 1st of February. We, by the way, we collected the reports on a monthly basis in the Ministry of Health. By March, we announced that it's an open option for any facility that wants to be enrolled in the Good Catch project through their regional quality and patient safety department that will contact the Ministry of Health, and they will be enrolled in the project. By June, we had 56 facilities enrolled in the project, and by October 2019, we reached 1,000 good catches. We did not think that we would reach it in the project, but alhamdulillah, by October, we reached 1,000 documented good catches in our facilities. By December, we were at 94, and by January 2020, when the project moved from ministry level to operational level on the facility, we reached 107 facilities in Saudi Arabia under MOH, from tertiary till the PHCs, implementing the proactive identification of risk through the Good Catch project. pointers on the analysis and the improvement activities. We wanted the facilities to analyze for patterns and trend, organizing submission to categories. We want to implement improvement actions based on what is learned from the good catches. And we wanted facilities to involve nominee or even nominator in the improvement effort. It was a very helpful point with staff engagement, involving them in the improvement efforts on good catches that they reported themselves. These are the good catch numbers in 2019 on the left. This is on a monthly basis, starting from January. We had a bit of low numbers on June and July, but the trend went up. And on the right-hand corner, or on the right side, we have the action categories, what action has happened as a result of these good catches. We had 7 improvement projects going on. We had 68 incidents where modification to our process or a redesign that was implemented. We had 47 cases of equipment and material upgrade in the facilities. These are all actions based on identified good catches that is working for a safer environment in our facilities. These are the top good catch categories. According to the Saudi Patient Safety Incident Taxonomy, it is released by the Saudi Patient Safety Center here in Riyadh. Based on that, these are the top categories: medication, then patient care management, ID and document and consent, lab issues, and environmental and safety issues. The impact on incident reporting. We cannot judge that it's directly to the good catch that this improvement happened, but fostering a culture of patient safety, of incident reporting culture, engaging the staff, and eliminating the fear of punishment. In 2018, we had a rate of 0.7. By 2019, we had an average rate of 0.8 OVR per bed per month. 2020, we had 0.9 OVR per bed per month in MOH facilities. On the right side, this is the 2020 Ministry of Health OVR incident report, full report. You can see the two rates, the improvement from 2019 till 2020. In 2021, we are projecting and aiming to reach for 1 OVR per bed per month, inshallah. Celebrating good catches, celebrating our heroes, celebrating patient safety. Our heroes are our staff, our frontliners, our eyes, the engagement, celebrating them. That was a very big, huge part of this project. We had it in Al Qasim, celebrating patient safety in Medina, and in Riyadh, in Al Hassa region, which they had a very interesting experience there, and in Najran, celebrating good catches. This is a picture from a psychiatric hospital in Asir region, in our southern region, celebrating good catches, and in Jeddah, in the western region. We want to foster a culture celebrating good catches, celebrating patient safety, and empowering our patient safety reporters. Now, we move to question number 4. This will be our last question for the session. Mrs. Jawahar?
Yeah, so question number 4. True or false, safety rounds reports are considered good catch. Safety rounds reports are considered good catches. Let's see the result.
So,
yeah, so 74% answered that this is true, and 26 answered this is false, and the correct answer with Mr. Fahad.
the
Mr.
correct
Fahad, please.
answer is that it is false. Why? Because safety rounds, the scope of the rounds is to identify risk or incidents. We wanted something that is beyond the scope of an activity. So I'm going with 26% of the people. So we were talking about celebrating good catches, celebrating our staff, celebrating our good experiences. This is a very good experience with the Good Catch project in Al Hassa region. With us, our moderator is Mrs. Jawahar. She had the first-hand experience. She was involved in the Good Catch project in Al Hassa region, and she can share her experience with us. Go ahead, Mrs. Jawahar.
Thank you so much, Mr. Fahad. Yeah, we in King Fahad Hospital, Hufuf, we had a good experience really in regards to Good Catch. Really, we had a good safety culture in regards to the event reporting system. And then when the Ministry of Health launched the project at the end maybe of 2018, we adopted this project in our hospital. We first tried to aware our employees in regards to the importance of near misses. What are the near misses? Then also we tried to use different ways of motivation and incentives. We started really with the high valuable rewards. It was a gift gold. Then we tried to use also different other ways, which are non-costly. As you see here, we have the day off rewarding. Then when these near misses received, we tried to analyze them one by one. Our responsibility as patient safety unit and quality and patient safety. Then we try to extract the root cause. Then we develop the corrective action plan. Then finally, we extract the lessons learned. Then we share it so everybody, he or she can take the benefit, for the employees. Why then also we shared this experience in the 8th Congress, the 8th World Congress of Clinical Safety in Barag, and really it was a very nice experience at that time. The result, alhamdulillah, we achieved our goal. We started maybe by just 7 near misses per month. Then it was increased to 25, then to 43. So alhamdulillah, we achieved our goal, and until today, we sustained this success, and we had every month different stories with content of events with different good catchers, and also annually we are celebrating a high number, and we appreciate the employees who they consider the good catchers or the best reporters for the incident reports. And alhamdulillah, this is a strength point really to our hospital. And also we are so happy as patient safety team to meet them really every month and to hear from them what are the stories. And really we are working every month really to just trace these events and to do GIMBA to know what happened exactly. Then we develop the strategies to prevent this errors from happening or the harm to reach to the patients. So this is really our story. And inshallah, I hope that you will sustain it or you will create it in your hospital. Then you will see how really the feeling of the success.
Thank you very much. A very lovely, successful experience. Also, we participated the project in the second Saudi Patient Safety International Patient Safety Conference. It was on December 2019, celebrating the good catches, celebrating the good projects. These are a snapshot of the pictures celebrating good catches all over the kingdom in our facilities. Celebrating people, encouraging reporting, engaging people. This is what we want. We want people to engage, people to know that reporting culture must be raised on every level, in every facility, from the first liner to top management. All of these, our projects in MOH hospital facilities, we are planting a seed of loyalty to the hospital, loyalty to the adhering to the policy, loyalty to our community, loyalty for patient safety. This is our message. This is what we want. And last look at the project number. We started in January, aiming for 1,000 good catches. Alhamdulillah, we ended with 1,517 by the end of December, 1,517 incidents where harm was stopped before reaching the patient. This is our last slide. I like this saying, perfection is not attainable, but if we chase perfection, we can catch excellence. Thank you very much.
Thank you so much, Mr. Fahad. Thank you so much, really. It was really a very valuable presentation. And now it's the time to answer our attendees' questions. We have your first question. How do you calculate the OVR rate per hospital bed per month? First of all, just let me clarify that in our hospitals or facilities in Saudi Arabia, we are using the OVR terminology. It's indicate for occurrence variance report. It's similar to incident report. So, Mr. Fahad, how do we calculate the OVR rate per hospital bed per month?
It's a simple calculation, and we did not find a reference for calculating the beds. We debated about it. We are calculating just a simple equation, OVR per bed, active beds in each hospital each month. This is how we calculate this.
So I hope we answer your questions, Catherine. Now, the second question is there an international benchmark for OVRs?
Actually, we did some research about it. There is no benchmark internationally for OVR. Some are calculating based on beds, some are calculating based on patient days, and some are calculating it based on 1,000 patient days in the hospital. So there is no benchmark that I have know of. So if you have a reference for that, please share it with us.
Yeah. Now, another question. What is your national plan to move this initiative until the sustainability in your country?
Okay. The kickoff of the project and all the things that we did during that year was setting the platform, the base for encouraging people to report. This initiative was moved from ministry level to operational as an operational project in our hospital. We did not want it to be a centralized project. We want it as a daily activity, a monthly activity within the hospitals. We are in November. This is the quality month, celebrating quality, celebrating patient safety departments in in Saudi Arabia. People are celebrating good catches. We are in 2021. So we are maintained and sustained this project for 2 years, alhamdulillah, and pushing it for more, inshallah.
Inshallah. So, any other questions, please? Till we have 5 minutes. So please, if you have any question, feel free to type them in the Q&A icon so we can answer them live now. Most welcome, really. We are so happy, really, to have you, and thank you so much, really, for joining us in this presentation. We are waiting for you if you have any questions.
There is an interesting question, Mrs. Jawahar, in the chat. What challenges you faced while initiating? The change, bringing something new, and healthcare professional trusting in the process of nominating good catches. You need to build the trust. You need to build it when selecting good catches, that people will believe in the process. And the most, maybe the most important thing was our emphasis in our workshop, on-site workshops, that MOH, the General Directive of Quality and Patient Safety, had a commitment, a public commitment, that we are protecting each and every good catch reporter for reporting any incidents in our facilities. That was a game changer in the project, and the reports coming in from this project. Okay.
Yeah, thank you so much, Mr. Fahad. We have here also some questions. One of them, can you tell some examples of good catch events?
Catch events, as I said in the beginning, the first 3 slides of the events that happened in the good catch. There was one interesting case that happened in Al Qasim. Al Qasim is a central region in Saudi Arabia. There were twins born in the same hospital. They were very similar. But one of them, due to an injury in the hospital, had a scar on the right, I think the right thigh. Okay. They got discharged, everything went okay, but one of them returned to the hospital for a medical procedure. I still remember the Indian nurse in the neonatal ward. She remembered the twins. The father had forgot or got his kids mixed up on the identification process and the identification at the reception, and he got the wrong name of the baby in the system. But the nurse remembered the twins, and she remembered that this twin who had a scar on his right leg was not the twin that it is in the documents or in the electronic system, but it was on the side of the father. But it was caught by a nurse Who remembered the twins when they were born? It was about 2 months or less.
Nearmisses, dear participants from different countries, really many thanks for your attendance and your time. Thank you for joining us this day. See you soon at the webinar. Thank you all again and have a good day. Thank you so much.
Thank you very much. Thank you. Thank you, everybody.
مع السلامة.
Keep safe.